This is our last presentation in this module around looking at developing indicators for measuring impact and success. In particular, in this session, we're going to talk about creating indicators to measure the impact of your allied health assistant within your team. The learning outcomes remain the same as the last two. So we're going to talk specifically about how to look at client impact indicators, staff, service organisation and business impact indicators. The first step is to be very clear about your driver. This is then your key indicator that you want to measure. We've been through a number of different modules that help us to understand how to be clear about our drivers, in particular with allied health assistants. We've given an example of this driver, remembering, of course, that your driver needs to be close to outcomes. So here we've proposed a suggested driver and the suggested impact that you're hoping to achieve. Recall this picture. As you know, there are multiple different ways that you can influence an allied health assistant to be impactful on client outcomes. This means that there are multiple different areas that you will need to measure in order to understand the true levers that influence the impact of the allied health assistant. Every single one of these fields is a lever that, if you pull or tweak, will influence how the allied health assistant is able to influence client outcomes. The bottom line is to know how you're going to measure these different fields and use that to set a baseline and then measure the success of implementing your allied health assistant. Let's look at a series of questions now that might help you to understand various ways that you can do this. Firstly, how do you measure and track client goal attainment? How do you measure and track client satisfaction with their care? How do you measure and track how effective your organisation or staff are in enabling clients to achieve their goals? How do you measure and track client needs? How do you measure and track how well client needs are being met? I'm hoping that you can see a pattern here. If you recall the image with all the different components, at the core of it is the client and how your different areas of your allied health assistant interventions and all the factors that influence the allied health assistant may impact on the client. These questions are specifically around client-level drivers. If you're motivated to make sure that your clients are able to achieve their goals and that you are doing this by meeting client needs, then you need to have specific indicators around those two areas. When you implement your allied health assistant model of care, you can then see if there has been any change in these measurements. Again, recall our image with all the different mechanisms that influence an allied health assistant to be successful and to impact client outcomes. What we know is that you need to make sure that your allied health assistant and allied health professional input is matched to client need. We saw this in a number of teams in our UK study. We asked them to designate what client needs were when they came into the service, and we looked then at how their team went about providing care at different levels of need. We found that on average, allied health assistants were generally given client caseloads with low-level needs. This is what you would expect to find, and often this is where an allied health assistant works best. But there certainly were teams that were very mixed in how they designated their workforce to client needs, and in some instances, allied health professionals were often seeing more lower-level needs clients than allied health assistants, but they only knew that because they tracked the client needs in the first place and then looked at how their assistants and their allied health professionals were being utilised according to client needs. How might you do this in your organisation or your service? Finally, one of our macro-level goals might be to ensure you are able to meet community needs. How then would you measure and track what community needs are? How would you measure and track how well you are meeting community needs? A suggestion here might be that you've done a needs analysis and you've identified that there is a gap around providing paediatric services, for example, to clients with disability in your area. If this is something that you want to change and the reason why you implement your allied health assistant model of care, taking a baseline of community needs and then being able to follow up with how you've changed or met them is an important indicator to show that you've been successful when implementing your allied health assistant model. This indicator is an important one if your driver is to ensure that you can provide high quality care to the client but at a low cost to them and also potentially to your business. But in order to demonstrate that as an impact, you need to understand how you measure and track the cost of care provision directly to the client. What does your care cost the client in order for them to achieve their goals? How are you going to find some numbers around that? And how are you going to show a difference when and if you implement your allied health assistant into your team? One of the key indicators, and this is certainly in our case study, that you could really focus on when you implement your allied health assistant into your model of care is how do you measure and track the demand for the allied health assistant and how well they're utilised. But in order to track this and to measure a before and after, or to measure ongoing indicators around allied health assistant utilisation, you need to know how you're going to do that in the first place. In the case study, which we'll show at the end of these slides, they talk about looking at allied health assistant demand by unpacking how consistent allied health professionals are in using their delegation form. And secondly, they look at billable hours for allied health assistants. We know that how well allied health professionals delegate to an allied health assistant directly influences the effectiveness of an allied health assistant in achieving client outcomes, in being satisfied in their job, and also how effective that is on the costs of care provision to the client. We know that poor delegation leads to inconsistency and underutilisation of allied health assistants. This is also an important measure to track. Here is another area that you could track, in particular if your drivers are around reducing the cost of high quality care to your consumer. How is it that you measure and track your staffing costs? In particular, if you introduce an allied health assistant, how do you measure and track the costs associated with training, supervising, and developing allied health assistants in your organisation? How do you measure and track if there is an efficiency in this if you take on more allied health assistants, or at what point the cost of providing training, supervision, delegation and mentoring for allied health assistants outweighs the cost of using an allied health professional to deliver the services? How are you going to measure and track that? Key to an allied health assistant's ability to provide high quality care to the clients is their level of competency and capability in performing their role. How are you going to track and measure how well allied health assistants are doing this, and if they're improving, and if that's influencing client outcomes? How do you measure and track how effective your allied health supervision, training and development systems are? We know that allied health assistants are only going to be effective if the systems for supervision, training and development are clear and codified and process driven. How are you going to track how well you're doing that? We've also seen in our previous slides all the different factors that influence staff satisfaction and retention. Do you track and measure this? When you introduce an allied health assistant into your model of care, how will this change? And finally, how do you track and measure your organisational culture? We saw from our previous slides that there are a number of factors within the organisational culture that influence overall staff satisfaction, intention to stay or leave, and can also influence the outcomes of client care. Do you measure this routinely and track it within your organisation? One of your core drivers may be to see that your service capacity grows and you see some business growth. How do you measure and track this? In particular, how do you measure and track a baseline and then what that looks like after you've implemented an allied health assistant into your team? We've been through a number of different indicators that you can consider. In this case study, when I spoke with the CEO of the organisation, that's a for-profit disability and aged care provider in rural New South Wales, these are the kind of indicators that they measured. But let's revise first what their drivers were and their desired impacts. First of all, they really wanted their clients to get more therapy for less, and secondly, to provide more for people, more options and more opportunities. The desired impact of implementing an allied health assistant to achieve these drivers was to see that the clients got a more holistic and comprehensive service, that they could unload hours of professional time, and that it could be a cost neutral and not a cost negative endeavour. So here were some statements that I captured around how they went about trying to measure if they had made an impact on clients in terms of receiving more therapy for less, in terms of being a cost neutral process, and also in terms of releasing allied health professionals from lower level duties. The question I asked was, so was this implementing AHAs a realistic solution for your business at the time, given your resources and your setting? And here was the answer. We didn't need to ensure that it was a cost-positive process, but we couldn't have implemented AHAs earlier than what we did, because you need to have wriggle room. And so once we identified that there's a bit more space in the NDIS for qualified allied health assistants to provide services, that we weren't going to be losing lots of money, that we hope we will break even on it and provide a better service. Can you specify what you mean by wriggle room? Do you have a percentage you'd need to look at? I guess we don't take stats on that, and with everything going on work-wise now, it's really hard to work anything out. But I guess we can absorb a wage. Yeah, really, that was the most important thing. Here's the key indicator that I was talking about earlier. The CEO discussed that they've got the supervision framework in place for their AHAs as well as a delegation framework. But when they go through that, it's quite clear that it's heavily utilised by some staff and not by others. That would be a key indicator that helps you to identify where you might need to make changes and improve the efficiency and effectiveness of your assistant workforce. And this is how they did it. So we're trying to upskill staff in how to use the framework. If you are trying to identify key things that you've learned along the way that others might need to really consider before they launch into implementing an AHA model, what would they be? The advice from the CEO of the for-profit aged care and disability company said, first, it's not a cost-positive process. Often people employ AHAs to increase revenue, but it's not the case necessarily with AHAs. And I do hope, after all the slides we've been through, in particular the slide that shows all the different mechanisms that influence how successful an AHA can be and how impactful they can be on client outcomes, we understand that it's certainly not a cost-positive process that there is significant resourcing that goes into making an AHA as efficient and as effective as possible. And finally, he stated, I guess they need to assess or create a reason for them, the AHAs. It might be to relieve therapists or to better meet client needs, or if it's to do all the behind the scenes stuff or whatever it is, make sure you know what they mean to do. Drivers need to be close to outcomes. Thank you.